And thank you so much for joining us. My name is Jackie Garlock, and I am with the Community Technical Assistance Center at NYU's McSilver Institute. And I would like to welcome you to today's offering, What Gets in the Way? Barriers in Family Work in Under-Resourced Communities. Welcome, everybody. Thanks so much for putting your information in the chat. We love seeing who is part of our audience today. During the webinar, you all have been placed on mute to avoid any background noise that may distract others from listening to the presentation. So we ask that you stay on mute unless you're going to be speaking. And I think we will have some opportunities today for folks to participate, which is very exciting. If you come across any technical issues during today's event, please chat to my colleague Leslie, who's under the McSilver admin, and she will be able to assist you. If you'd like to activate closed captions, you can do so by clicking the toolbar button. There's a little thing that says show captions, so feel free to do that. We will have a Q&A portion toward the end, so please put all of your questions in the chat at any time throughout the presentation, and we'll be keeping track of that, and then we'll have a Q&A section at the end. And at the end of today's presentation, we'll have a short feedback survey. We'd really appreciate you all completing it. We really do look at these surveys and we use it to inform our future offerings. So especially if you have any suggestions for things that you want us to do presentations on, if you want more things like this, please fill out those feedback forms. We really do take those seriously. And then lastly, the recording and the slides for this presentation will be posted on the CTAC website, which is ctacny.org. And usually it's within the next 2 to 3 business days. So you will have access to all of the slides and the recording online. So thank you again, everybody, for joining us. So excited to have you all here for What Gets in the Way, Barriers in Family Work in Under-Resourced Communities. Our presenters today are Nicole Lee and Stephanie Rodriguez. Nicole Lee is part of Vibrant Emotional Health. She joined their national programs where she works closely with crisis centers across the U.S. to ensure quality service provision for 988, the National Suicide and Crisis Lifeline. She's had many amazing past professional experiences as well. She's directed an outpatient child and family mental health program serving survivors of gender-based violence, led a team providing emergency transitional housing to families that are fleeing DV, managed a school-based mental health clinic program, and also has served as an administrator at a New York City public hospital. And if that isn't enough, she's also has her own private practice that she's been serving children, adults, and families and couples since 2016. So welcome, Nicole. We also are joined by Stephanie Rodriguez, a mental health therapist with over 10 years of experience. She is the founder and lead therapist of Emergent Mental Health Services, a private practice in New York City. She works with children, adolescents, and adults struggling with a variety of mental health issues, including depression, anxiety, and trauma. As a bilingual Spanish-speaking clinician, she's able to ensure that language is not a barrier to receiving treatment. She utilizes interventions such as cognitive behavioral therapy, trauma-informed cognitive behavioral therapy, and then mindfulness-based stress reduction, acceptance and commitment therapy, and neurocounseling. Prior to working in private practice, Stephanie worked for a nonprofit organization as a school-based mental health therapist, where she provided therapy to students and their families. So excited to have you both here, bringing all this amazing experience and wisdom, and I'm really excited to learn from you and from everybody here. So thanks everyone for joining us. I'm now going to pass it along to you, Nicole and Stephanie, to get us started.
Thank you so much, Jackie. Welcome, everyone. We're very excited to be here. Love seeing the representation from all over New York State. If you didn't get a chance to yet, please do share where you're coming in from. We love to see all the work that y'all are doing all over New York State. So I'm going to kick us off. I'm going to go over our agenda. I also wanted to plug that Stephanie and I used to do this work together. We are both therapists in a school-based mental health clinic program in a New York City neighborhood, working in public schools. And so we draw a lot of this information from our firsthand experience, but we really want to hear from you as well. So please, we're monitoring the chat and looking forward to your thoughts and questions throughout. So we're going to dive into what is family work. We're going to kind of come to terms of like what our definition is here in this space. We're going to talk through some different barriers that we've seen and experienced with what what successful family work can look like, and really dive into how stress shows up for caregivers as a barrier to engage. We're going to touch on the influence of generational patterns, also how systemic oppression plays a role. And then we want to leave you all with some tools and some resources and ways that you can strategize and engage and work through and around these barriers with families. And we have some case examples. If time allows, we'll get to dive into applying some of these ideas and observations and tools in real time and wrap up with a Q&A. So yeah, please chat in, share your thoughts. We're going to ask for your input, and to get us warmed up actually with that, we're asking y'all, what in your ideal world, in your ideal mind, idealistically, what does family work look like? So what would you want to see if you're engaging with the family? What are expectations that you have around family work and what it ought to look like? And you are able to chat in or raise your hand to share, go off mute. We'll call you in. Oh, awesome. You all are chatting in so quickly. Okay. Collaboration with everyone involved, co-regulated relationship. Thank you, Colette. Everyone is open to participating, engaged, knowing that everyone is doing their best. Unconditional. Oh gosh. Yeah. Inclusiveness. I'm seeing collaborative a lot. Stacy, your hand is up. Go ahead. Can you take yourself off mute? There you go.
Uh, cooperation within each person. So not just with like the parent, you'd have to work all together as a family.
Absolutely. Yeah. Cooperation, collaboration, participation of everyone. Fantastic.
Saw someone also include engagement there. Very good.
Culturally appropriate. Yeah. Thank you for raising that, Eileen. Joint decisions as well. Yes. Oh my gosh. Yeah. These are great, y'all. Okay. So we have some ideas of idealistic expectation, kind of what we as providers in this space want to see, want to, promote, want to make space for. Excellent. Whatever it takes, Trish. Okay, we're gonna kind of get to that. I like that. I like that line. And their voice should be at the forefront of all decision making. Awesome, Denise. Thank you. All right. So I think I'm passing it to Stephanie here.
Yes, thank you all for chatting, giving us your input. These are all great ideals of what we hope to see in family therapy. And we know that many of you have your own cases as well, various case examples for family work. But we wanted to also present this case about Alex and his mom. So Alex is an 11-year-old male in the 6th grade and was referred to therapy by his guidance counselor and his mother to work on navigating being in a new school and family changes. Alex lived and attended school in a low-income neighborhood. Because Alex was struggling with this transition, the therapist attempted to work closely with his mother, his teacher, and paraprofessional. The majority of the therapist's work entailed building trust with his mother, who was a single parent and struggled to trust others for fear of having various ACS cases open against her, as had happened in the past. Alex's mother was also working full-time and caring for 3 other children, one of which had a physical disability. The therapist worked on educating her on everyone's role on Alex's support team and ways therapy can benefit. Therapist also scheduled parent sessions via phone calls and offered phone call check-ins whenever her schedule allowed. As Alex continued therapy throughout the entire of middle school, this allowed the therapist to establish a stronger rapport with his mother, and she trusted the provider with supporting Alex, made outreach calls outside of the scheduled sessions or parent sessions, and was able to connect with the school staff for additional support. Can everyone still hear me? Okay, great, thank you. So we wanted to present this case, we'll go over it later on, and also wanted to share some guiding questions. We're not going to answer them now, but just some things to think on throughout our presentation. Thinking about Alex's case, what were some of the barriers that were presented as a challenge to the family work in this example? what stressors might the caregiver be experiencing, and what interventions, tools, or strategies were implemented to help maximize engagement.
Great. Thanks, Stephanie. All right, so to get us all on the same page, we're going to dive into how we're defining family work in this space. So again, asking for your participation, what defines family work? So we kind of talked about what our expectations are. We talked about collaboration. We want people to show up. We want shared decision making. We want people to have buy-in. What other ways would we define what actually is family work? If y'all have ideas, please chat in or raise your hand for us to hear your voice. Anything that links families to resources. Yeah, Shannon. Yeah, exactly. It's really like a linkage. It can be a linkage connector to other supports, other resources. Any other ideas? And we can move on to our, oh yeah, of course, y'all are rolling in with so many. Supporting parents in their vision of parenting that then supports the development of their children, identifying ways to address concerns the family members may be experiencing that are negatively impacting them, using active listening to better understand the needs, do not problem solve too quickly, build trust, alliance with families, looking at relationship matrix, meeting families where they're at, connecting with mental health resources can be a way that it looks, empowering families, letting all family members have a shared voice. Amazing. Y'all are talking about like exactly what like the modality might look like, but also, you know, strategies and tools for engaging. These are fantastic. Okay. So the kind of definition that we came up with, I'm going to pass it over to Stephanie to talk through.
Thank you. So family work, yeah, we acknowledge that it's something that is helpful for supporting sometimes if we're working on individual with individual therapy, and we also want to, of course, include some of the family work. Family work is a discipline of therapy that focuses on working on challenges and complexities that may arise in the family. Various types of modalities include, but are not limited to, family systems therapy, emotion-focused therapy, and structural family therapy. And family therapy can look differently depending on so many different varieties, so many factors, but it could be in-person sessions, virtual sessions, phone calls, parental counseling sessions, of course, family sessions and group sessions, and of course, care coordination. And some of the goals can, of course, be expanded upon these, but here are some examples of common goals of family work. So, for example, they could be coming in to help solve recurring family problems.
Sorry, hold on. I'm having some technical difficulties. Let me just reshare my screen.
No worries. And looks like y'all, if you don't have the ability to chat to everyone, we're going to do our best to share out everyone's comments. But if you, it looks like everyone should be able to chat to everyone now. So if you just change who the message is going to change that from host and panelists to everyone, then everyone should see all the chats.
Okay, great. Everything should be said now. Sorry about that.
No worries. Thank you.
Of course.
Okay. Yeah, so solving some recurring family problems could be a common goal, but in addition to that, they could be wanting to address a specific challenge, wanting to work on improving communication, learning about a youth's mental health, so where a lot of psychoeducation could be covered there, crisis management or managing family stress, or as well to increase support overall among family members. Are there other goals that any of you can think of as well that are not listed here? Feel free to use the chat or raise your hand.
We tried to be as inclusive and exhaustive as possible, but we know we could miss some
Yeah.
things.
Yes, absolutely.
Finding
Identifying their
joy.
supports.
Colette.
Yeah.
Oh, I love that. Yeah, like having fun together, having joyful times together again. Yeah.
Yeah,
Identifying any mental health needs, supporting parents. Excellent.
enhancing
Excellent.
attachment. Yep. That's accessing and understanding resources. Absolutely. Learning about the community, how to stay connected, how to be informed about resources in the community and beyond. Absolutely. Great. Thank you all. I really appreciate even mentioning finding joy. A lot of this is hard work. It's very serious. It's all super, super important. But oftentimes they may not have the space to play games, to do some artwork together, or to talk about some good things that are going on as well. So it's good to even think about that as well. How can you include some joy or fun in family work? Thank you all. I'll pass it on to Nicole.
Yeah, we're going to keep the conversation going. And so we've talked about the like our shared definition of family work, how all encompassing it can be. We've talked about how we expect it to look, kind of what we want it to look like in this space. We want to kind of understand your thoughts around what gets in the way. In your experience, what are some barriers to this kind of family work actually being able to happen effectively or successfully? And yeah, Shannon, differing viewpoints within the family, childhood trauma, resistance to work through issues, stigma, scheduling conflicts. Yes, transportation. Yes, all the concrete barriers, childcare, telehealth. And then we got generational trauma, ACEs, previous bad experience with services, turnover, trust, substance use, lack of support from a systemic standpoint. Exactly, y'all. Scheduling, parents refusing, having difficulty accepting change, poverty, lack of resources. Exactly. Y'all are hitting it on the head. Exactly. Family not recognizing their contribution to the problem. So like accountability, reflection, disabilities. Excellent. Okay, y'all. I mean, you
Yeah.
really got the list that I think we came up with as well. So we've got common barriers that we were thinking of around stress, competing priorities, expectations of what family work ought to look like, expectations on themselves, expectations of the services, ineffective communication, both maybe between families and providers and systems, but also within families, limited financial resources or access to mental health services, stigma around mental health issues, which a couple of y'all raised as well, and language barriers, having providers that can speak the language that the family speaks and the caregiver speaks, being available. So at the top of this, what we're going to really dive into and focus on in this space today is stress and how stress is influenced and exacerbated in a caregiver space, and how that can really be at the core of so much difficulty with engagement and family work. And what can we do as providers in various spaces to acknowledge and hold space for the stress that caregivers experience, and do the most that we can, do everything that we can to support them. And I'm going to pass it to Stephanie.
Thank you. As mental health providers, it is important for all of us to understand the different and unique challenges that the caregivers that we work with are experiencing within under-resourced communities, and how that can, of course, get in the way of the support, seeking support for their mental health and their family's mental health. And keeping in mind that engagement can be low because the stress is high. So here are some common caregiver stressors that we listed here. And then we'll go over further here in this list here that we've kind of put together. So being a caregiver to multiple youth and other adults, maybe even older adults, being a single parent, going through divorce or separation, managing a parallel parenting or co-parenting relationship, other responsibilities such as work. We talked about scheduling, how that can be a challenge, financial pressures, limited education, cultural expectations, caregivers' own mental health, caregiver burnout as well, and then limited access to resources. Is there anything that you think that we missed that we didn't include on this list? Something that you're seeing in your work?
Christy mentions when caregivers are told they have to participate. That's yeah, like a mandated service. The stress that comes with that, interacting with that kind of system.
Yeah.
Court-involved families,
Yeah.
overburdened, overwhelmed, domestic violence.
Their own trauma. Yes, absolutely. Feeling connected to providers, caseworkers, therapists. Yeah.
And Eileen mentions exactly, we have this later on as well, Eileen, but the fear of interacting with systems and what that means if you are, you know, undocumented, if you depending on your citizenship status,
Absolutely.
what implications that could have for you and your family.
Right.
Got community violence, absolutely.
Definitely.
Child welfare involvement, right? Other kinds of systems, other kinds of structural, institutional systems that play a role.
Yeah. Paulette, I saw also that you wrote in that in Japan, what families talk about is not discussed in public. And so like stigma around that, keeping things within the family as well, that's all super important and common, very needed to understand as providers.
Yeah, this idea of the environment too, right? Climate change, where you live, how different, just yeah, the environment both socially but also physically.
Yeah.
Safety, community violence was raised earlier. I think that's very real and important. And then making them feel like they are to blame, others will tell them how to parent, right? Being directive rather than being collaborative, or pulling for strategies that come from the family, not from being told what to do. I appreciate that, Denise. Great. We are all so on the same page. This is fantastic. Thank you for commenting and chatting in, everyone. So some of you actually raised this next bullet, which was in the image that Stephanie talked about earlier, around systems of oppression. And we need to make sure we name and hold space for these kinds of invisible, sometimes they're visible, inequities and structural challenges that families have to navigate, and folks that have, limited access to resources or limited education or different, abilities, or experience with other institutions, and, involvement with other, child welfare or court, how depending on who you are and the identities you hold, how these systems can actually perpetrate more harm. And we do know that families that navigate more of these systems of oppression are going to have less success, or less access, I should say, and engagement in therapy, because of all the stressors that we're talking about today that just compound and add to why, these barriers and these stressors are exacerbated. And I think when we were making this presentation and reviewing it with our team here at NYU, we were like, well, what do we do about this, right? Like, what do we do about these systems? And I think in our work, and we'll talk about this later on too, the first step is naming it, holding space for it, recognizing it. And Daniel's comment earlier around, like, how does it show up for ourselves in the provider's space, and what isms are we unaware of or not acknowledging? How are we letting those influence our decisions? And then how are they influencing the ways the families that we're serving and the caregivers that we're serving are able to navigate various spaces? And I see, Denise, lack of knowledge around learning how to be more affirming when having a youth that identifies in the LGBTQ community. Absolutely. Lack of resources, lack of knowledge there. So wanted to hold space for that, name that, because it's a huge influence. And I think in our experience, we know that those systems of oppression influence where generational patterns come from. Generational patterns aren't created in a vacuum. They are created in response to environments and situations, and these generational patterns can influence how stress is navigated and coped with. And so there's differences culturally between how stress is approached and managed. And so different values and beliefs and traditions can impact a caregiver's access or resources around strategies to deal with stress. There's going to be different pressures depending on your culture background. Someone mentioned, how things are navigated in Japan differently. Japanese culture is different than maybe American Western culture. So being aware of how those differences are showing up in the family work and possibly influencing stress, coping with stress. And then also parenting artifacts, like what's inherited from parent to caregiver to caregiver over generations without maybe a lot of awareness or a lot of like examination. So thinking about how communication styles or patterns are passed down from generation to generation, and maybe there's more models of more directive or top down or authoritarian parenting versus collaborative or just being aware of where these patterns come from, and also thinking about conflict resolution strategies. So, are there more instances of avoidance or denial in a family where there's not a lot of confrontation or a lot of discussion around how to work through problems or conflict together? And so an examination and bringing that into the work with a caregiver, with a family, of what are the communication styles that we're using here? What are the conflict resolution strategies that we're practicing here? Are they working for our family? Are they what we want to keep practicing? And I will pass it to Stephanie. Oh, sorry.
Okay. Thank you. Yes, absolutely. And in addition to the ways that we can see that generational patterns can influence the ways that caregivers navigate stress, we can see that it also can influence caregivers' readiness and receptiveness to treatment. So we might see that their attitude towards emotions, how to be open with someone, a stranger, someone who's trying to ask some further information about their family. And as we talked about earlier, how it is very common to keep things close, keep things private. But thinking about how to engage, how to express emotions, how to be vulnerable, which we can see that there could be some varying views. An example to this is someone saying, I don't need to talk to this therapist, I'm not crazy, right? The stigma around mental health and what they might think what therapy is for, and ways that it can be helpful or sometimes even unhelpful, as they might think. And then, of course, we have intergenerational trauma, thinking about ways that family experiences, traumatic experiences, could continue on, can perpetuate having unresolved issues as well from past generations, and how this can influence their openness to treatment. An example to this is, as we mentioned earlier, what goes on in our family stays in our family. We don't need someone externally helping us. This is private. This is something that we'll work on our own. And so next we'll go over tools. As we said, like now that we understand these different stressors, these different systemic oppression as well that families can be experiencing, what do we do about it? So here are some tools to support caregiver engagement. So we wanted to highlight empathy and building trust and rapport with family, as we're recognizing that engagement is these are what's at the core of engagement overall. And we'll talk about this later in some of the case presentations. But as we're identifying ways to engage parents and caregivers and families, how do we keep them as well? How do we maintain that engagement throughout too? So in addition to acknowledging empathy, being able to place ourselves in their shoes, to imagine what this can feel like to be on the client side. And even if there are some ways that perhaps there are some similarities in culture, what are some differences as well? Keeping that in mind, having some sensitivity around that too. But ways that this can all help with building trust and rapport. can be really helpful as you're trying to navigate their engagement. So being sensitive as well and discussing any cultural, generational influences and systemic inequities, keeping in mind as well any power differential between you as a provider and them as a client. Acknowledging any progress and accomplishments as well. So using positive reinforcement to continue that motivation and engagement. No, there's no size that matters in this case. This is all important, and oftentimes recognizing those small things too can go a long way. And even every kind of engagement, every point of engagement can be considered a success. You can also collaborate together on goal setting. Having their buy-in is really important, involving them in setting the goals for family therapy and ensuring that you can work together to support everyone's investment in the therapeutic process.
Right, to continue on, some additional, oh, I jumped ahead again, Stephanie, sorry. So it's some additional strategies that we thought of. So something Stephanie and I used to do was make sure that families that we were working with understood everyone that was involved in their work. And so something as rudimentary and simple as writing down all the providers or all the different team members that might be involved in their family's life for various reasons, like especially if there's like a mandated sort of situation, or if there's a lot of school involvement and maybe an IEP, you know, writing down the school social worker does this, the therapist does this, and their names, their contact information, if there's recurring appointments, like writing things down to help kind of have systems of organization for a family and being transparent about that with all the family members. So kind of making those lists collaboratively with the caregiver present, with the child present, so that to the extent that's appropriate, everyone understands who's doing what with this family. And I always found it really grounding and helpful for myself, and additionally for the family, just to kind of understand who's who in the teamwork that is happening in the family workspace. We wanted to also raise that, you know, sometimes you have family sessions and you also have the option for parent sessions, but parent sessions aren't always an option. We have families that are single caregiver homes, multiple children, not going to be able to have childcare as a resource or an option. So wanting to kind of expand our, you know, expectation and level set that sometimes we make the most of whatever we can get. We do whatever it takes and make the most of every opportunity we have and every kind of point of engagement. Like Stephanie said, every moment of an engagement is a success. And so the kind of a reframe for us to be viewing it that way as well. And so making the most of each interaction, being flexible, like maybe there's not the space for an individual parent session because other children are needing to be present, or scheduling barriers present a challenge. So being flexible to the extent possible with phone call check-ins, or other creative ways that you can, you know, walk and talk with a parent, or obviously, you know, honoring confidentiality, but making the most and being flexible. And we also wanted to share out the single session solution focused therapy idea, where the mindset is you treat every session as if that is and will be the last, first and last. So you're going to make the most of whatever you can. And in our work, sometimes you wouldn't see a parent very often because of all these competing priorities. And so really kind of going into that space with like clear goal setting, with collaboratively with the caregiver, with the family, whoever's present, and making the most of whatever you can in that space, and kind of setting yourself up with that expectation as well. And finally, we would also want to collaborate with other providers. You know, we don't work in a vacuum. Families don't live in a vacuum. There's lots of different layers of involvement, from, you know, schools to healthcare. And I see, Denise, your comment around the family peer advocate. I think that's a great suggestion and recommendation. Peers are invaluable. Having lived experience adds a lot of support and helps build that trust in these spaces. So if there's also that linkage that you can make, we would absolutely recommend that. And then I think I'm passing to Stephanie again. No, it's still me. Okay. So additional resources and supports that we wanted to raise out. Exactly, Lynn. Yes, family peer advocates rock. So we wanted to share out a resource directory that we used to use a lot. It is, I think, very focused. I think it does offer up into New York State. It may be more. Remind me, Stephanie. It may be more New York City focused.
It is, yeah.
Okay, but we wanted to share this out for folks who might be in New York City, and also just think about other, just ways to connect with low cost or free programming for youth, whether it's after school or summer camp options, or connections to healthcare, mental health care, peer programs, being able to know how to access those and recommend them to families when appropriate. And then also encouraging caregivers to connect them with school staff, and if possible, if your role allows, be able to participate in those meetings. Being a school-based mental health provider and also working in a shelter, I and my social workers and my team would be present for IEP meetings, or maybe do a warm handoff with a new provider that's being introduced to the family. And so to try to be, to the extent that caregivers are, amenable to it, be present and be another set of ears and be an advocate in those spaces. And then online resources and support groups. So we just put a couple in here with the National Alliance on Mental Illness, just in terms of providing psychoeducation and different resources and support groups that might be available through that organization, as well as New York State Parenting. It's a website with lots of resources on access to childcare and parenting tools and tips, and different programming across New York State. That's would be a great resource for families. And now, is it still me? Yes, it's still me. All right, sorry. And so this website is the single session solution focused therapy. So if you're interested in learning more about that approach, recommend you check out that website there. There's screening tools here that we've linked from Mental Health America, just another resource for providers in this family work. Again, linking the New York State Parenting resources that I mentioned, that's got resources for families as well as resources for providers. And then CTAC resources. So we've got a great LMS course that really emphasizes a lot of what we've talked about here, but in much more detail around learning the basics of family engagement. And Colette, I see your comment there, promoting parental self-efficacy. I think that's huge. I think that's an important, and you're probably hearing my dog bark in the background. Sorry about that. But I think that's a huge point, because we don't want to, the goal is to set up our families to be able to do this on their own and have these resources internally and not need the connections to external providers. So I think that self-efficacy is a huge point of importance that we should emphasize. So thank you, Colette.
Yes, thank you. Absolutely. Advocacy is on the other side of the systemic systems of oppression that we discussed as well earlier. Being able to know that there are resources that they can then take on from there. So absolutely, thank you, Colette, for adding that. So we wanted to bring back these guiding questions to you all as we are diving into some case examples. So keeping these in mind, and Nicole will add them as well to the chat, but what barriers presented a challenge to family work in this case example? What are the stressors that the caregiver is experiencing? And what interventions, tools, strategies were implemented to maximize engagement? So I'll bring back the case of Alex and his mom. So I'll review again. Alex is an 11-year-old male in the 6th grade and was referred to therapy by his guidance counselor and his mother to work on navigating being in a new school and navigating family changes. Alex lived and attended school in a low-income neighborhood. Because Alex was struggling with his transition, the therapist attempted to work closely with his mother, teacher, and paraprofessional. A majority of the work entailed building trust with his mother, who was a single parent and struggled to trust others for fear of having various ACS cases open against her, which unfortunately had happened in the past. Alex's mother was also working full-time and caring for 3 other children, one of which had a physical disability. Therapists worked on educating her role on Alex's support team and ways therapy can benefit, scheduling parent sessions via phone calls, and offering phone call check-ins with her whenever her schedule allowed. As Alex continued therapy throughout the entirety of middle school, this allowed the therapist to establish a stronger rapport with his mother. She trusted the provider with supporting Alex, made outreach outside of their scheduled calls, and connected with school staff for additional support. So thinking back on those guiding questions, what do you all think are ways that, thinking on to this case, ways that we have acknowledged the barriers that were getting in the way of family work?
Julie just chatted in to us that some challenges were being a single mother, mistrust of providers, taking care of other children, having a child with disability. And Christina mentioned barrier of trust.
Yes, absolutely. And thinking too, what have been some of the stressors that the caregiver was experiencing? Yes, living in poverty, being in a low-income neighborhood, and the limited resources as well, that being in a low-income school and neighborhood as well that can be provided.
Being in a new neighborhood too, where they had just moved. So like not knowing resources, not knowing what was available in their new neighborhood. We don't know why they moved, but that's I mean, moving is a major adjustment for a family and for children. So
Yes.
Yeah.
Yes, having various ACS cases, child welfare involvement. Yes, and being a single parent of multiple children and one with disability. Yeah.
And Kathy mentioned kind of looking at interventions.
Mhm.
The intervention question of great, like how helpful it is to build trust through like phone call and check-ins. So some of those, like depending on where you work and if things are billable, like what things, how do you work that into your you know, what work is within these other systems, you know, authorized or billable. But yeah, the flexibility around being able to do some of that unbillable work that goes a long way. Those check-ins, the walking and talking, the warm handoffs, really building trust.
For sure. Even being present, like you mentioned, Nicole, earlier, being present too in the IEP meetings as well, any support there, collaborating with others. But yes. Yes, thank you all.
I'm curious if others would have other techniques they would use. The phone calls and check-ins, super helpful. Or what they're noticing was applied here to help navigate the stress and enhance family engagement, family work engagement. And Daniel's mentioning race, ethnicity, culture, not name, but there are possible racial and cultural dynamics at play too. Absolutely.
Of course.
And to examine those and to be aware of how that's showing up and impacting their access. Absolutely. Thank you, Daniel. And Laura's saying connection services such as care management. Love that. Yep. Connecting mother to other community resources.
Right. Thinking about being in a new neighborhood, absolutely. Communicating, being able to connect them, communicating those needs and resources. Meetings. Yeah, absolutely. If you work in a school, meeting students in the morning at drop-offs or pickup, absolutely. You're more likely to get a caregiver in a couple of minutes can really help and go a long way.
Kathy mentions, right, if they move, they may be further away from family or other supports. And so what they were familiar with or what resources they maybe had where they were before, or they're starting from scratch potentially. Right, to explore all these things in the family work. Like what, yeah, exactly. This is great. Identifying individual goals across therapists. Alex, mom, teacher, professional, find commonalities and differences to get on common ground. Yeah. To name these things, right? To like hold space and say what are we working on here? What's at play? Yeah.
Absolutely. I even want, I like Denise, what you mentioned here, like in-home supports, and if your program allows for any home visits too. So oftentimes parents are not able to leave their home for an hour, and being able for you to meet them where they're at to help support and in that engagement, that really does remove a barrier.
Call it, yeah, this going back to the idea of joy, right? And that can be a goal, like finding joy again, having fun times together again, and balancing that with the stress that comes with navigating all of these barriers. How can mom and Alex fill their cup for more difficult moments with joy? Yeah, with fun. Great. Okay, should we move? I think we have time for the second case
Yes,
example.
do it.
Okay, we were gonna see if we have time, and I think we do. So I'm gonna introduce the second. We're gonna use the same guiding questions, but we're gonna think about Tyson and Tina. So Tyson was an 8-year-old in the 3rd grade. We've changed all these names for confidentiality, but these are prior individuals we got to work with. So Tyson is an 8-year-old in the 3rd grade. He was referred to therapy by his teacher and principal to address focus and concentration in class, as well as improving social skills with his peers. After recent challenges with his behavior, the family work began with engaging his mother, Tina, who was historically not inclined. It says inclined, but it should be not inclined to collaborate with the school team. Of note, she had not finished school beyond 8th grade herself. The family lived in public housing and walking distance to the school, and mother was unemployed due to managing her diagnosis of epilepsy. Tyson's older sister, a high school student, also lived at home. After missing 2 intakes scheduled at the school, the therapist offered to conduct a home visit to meet with Tina. In the intake, Tina shared that Tyson's father had recently been incarcerated, which Tyson did not know. Therapist was able to work with Tina on sharing this information with Tyson and his sister, and continue to hold space for the family in adjusting to the change in their father's presence. Therapist also referred Tyson's sister to her own therapist for her own individual work. So if y'all would chat in, what were some, and we can kind of re-up those questions too. Let me recopy them into the chat. So what barriers were present here? What do we see with Tyson and Tina? What barriers presented a challenge and what stressors were being navigated? Yes, mother's medical conditions, mom not historically being open to collaboration, maybe some inherent distrust because of past interactions. Also, like naming, like the school can be the school space can be kind of can be an intimidating institution depending on your own experience in schools, like how you were as a student or how far you got in school, your education level. And so collaboration isn't always just like, not wanting to, but it can also just be based in intimidation or not knowing the tools or the language or access to resources. So kind of challenging some of our assumptions of why collaboration doesn't happen. Mom's diagnosis, unemployment.
Father's incarceration.
Mm,
Something to also highlight is the lack of or limited education that Tina had as well.
absolutely. Unemployment. Yep. Barriers to engaging, collaborating with other workers, with other providers. Stigma around mental health. Limited and maybe poor experience with education system. Exactly, Mary. Shame, embarrassment, thinking not good enough, stigma towards the benefits. Yeah, poverty. Exactly. And what sorts of interventions were we able to provide here? What did this therapist do to kind of work through or hold space for those challenges? Yeah, home visits. So 2 missed intakes. Luckily, therapists working in a place where they could commute and get to that home and do a home visit. So that was a flexible kind of accommodation. Yeah, Denise, this is huge. Like being able to read or write, and even are the forms in a language that the caregiver feels comfortable completing, right? Like that's hugely important. Um, and then therapists, yeah, got her older sister, her own therapist. I mean, so she could have a space to process mom's health and dad's incarceration. Um, and then therapist convincing mom to consent, yeah, for a home visit. Exactly. Great. Great, y'all. Earning trust, meeting mom where she's at, going to the home. Exactly. So these are two, snippets of, we know y'all have experience doing this as well, but we wanted to kind of expand ideas around these barriers and stressors and challenge some of the assumptions that we might make, and why there are barriers to family work, and what is ideal versus and what we expect to happen, and what is real and what we can really accomplish, and what we can also see as a success and see as a win in any kind of engagement with a family. So with that, I think we are on to our, yep, we got our guiding questions. Yeah, I think we're on our Q&A. So Jackie, I don't know if we had any.
We had didn't have too many questions, so if folks still have some questions, please put them into the chat, or you can also raise your hand, and we can allow people to unmute. So I wanted to there was a question that I had that I'm going to throw out there since we don't really have any questions yet. So I was thinking, how would you suggest that a provider balance providing sort of the right amount of support or pushing the right amount? And I think pushing maybe isn't the right word, but especially if a family is like a little bit more reluctant to engage, a little more like, not sure. This idea of like continuing to reach out, continuing to like there's like a delicate balance between sort of uh, doing too much versus sort of doing just the right amount. And I'm wondering if you have any thoughts on that.
That's a great question. Go ahead, Steph. I saw you move.
Yeah, I was just thinking too, especially in the beginning, there could be a bit more of that outreach and attempts for engagement. And I think even though sometimes parents can explicitly say what is getting in the way at times, being able to hear them out, acknowledge that sometimes they are busy, and that maybe providing these resources, these worksheets or handouts could feel overwhelming, can add more. I think that's also a sign that there could be maybe a bit too much of that support, or maybe there's like a limit for the provider, and acknowledging that could also be okay. What could work? Like maybe even if there's another way, like a parent teacher conference, for example, where a parent is already coming into, like, how can you join that so that it's not too overwhelming for families, and really listening to that, and being able to in turn allow them to use their voice to acknowledge this is too much, or I don't need this right now, or right now is not a good time.
And I on the reverse too, I think the idea of like reaching out too much, I think definitely utilize supervision, check in with your team, talk about, what is the outreach looking like? What's compelling that, outreach? What's coming up for you as a provider that may be influencing why maybe especially if your outreach looks different than how it does for other families. Like, is there something that's coming up for you around this family? And I think asking for permission, right? Like, is this okay with is it okay if making sure text not for clinical conversations or for service provision, but check-ins, or making sure you can schedule things, like asking permission for the types of communication you're going to engage in, and defining your role. These are things I can do to support your family. Is this something that you're asking for? If not, great. Thank you for letting me know. How can I connect you to what you are looking for, you know, and so getting that shared decision making and empowering that self-efficacy as much as possible. Yeah.
Amazing. Thank you so much. We had another question come in. Somebody asking, how do you work with families who state they have no natural supports and are reluctant to even work on discussing ways to identify them?
Yeah, that's hugely challenging. And I've worked with families in that scenario in domestic violence shelters for sure, where they've had to be removed from their supports because of the risk involved with continuing to engage with their natural supports. And so in those situations, there's a lot of that concrete resource development. So really not informing yourself, doing a lot of research of what is available in your community so that you can have, I mean, the number of referrals we did for childcare, you know, just to allow a parent to, and make sure they have access, like the waivers that are available from New York State to be able to pay for childcare and get that support. It's something as simple as that, putting that in place can help free up that space for that parent. But and I think to that second part of the question of what if they're not willing to engage, and there were definitely those situations as well in the shelter where because of trauma, because of there's a lot of distrust, they're forced to leave their natural supports, they're forced to leave their community to flee, which, you know, that's a whole nother kind of trauma for the entire family. Really trying to meet them where they're at and be clear about what are your role and responsibilities as a provider, what are theirs as the caregiver and for the family, and how do you balance what their goals are with what's available. And
Yeah.
Stephanie, anything to add to that? Yeah.
Absolutely. I think though that you touched upon some really great points, Nicole. I think it could be so challenging to, of course, acknowledge and honor that for them, that they, for different reasons, will have a hard time trusting others or needing to really separate from family. I think even just holding that space for them is so valuable, that this can be hard. And even if it's maybe within the family sessions or the parent sessions, that they can talk about that, and that you can also demonstrate to them that this is something that you can hold. This isn't too much for them. And then whenever appropriate, if there's an opportunity to advocate for some further support, or as we mentioned earlier, community resources too that feel appropriate.
Amazing. We have about 2 minutes left. We had one more question come in. It's kind of a big one. So I know that it's gonna maybe not, we want people to fully answer it in 2 minutes, but we have someone who is a supervisor for an MST team that uses a solution-focused lens, and therefore, therapists are trying to stay as present focused as possible. And she's asking, how can I encourage my therapist to acknowledge past or generational trauma while also staying present focused? So just a tiny little question.
Yeah, balancing, right? The past with the present, what's happened in the past that's influencing the present. And I think in my experience, it's a constant examination, definitely using supervision, using my peers, my team to explore and make sure and use and meeting the family where they're at in terms of their priorities. What are we working on here that is their top priority, and making sure I'm centering that, and with the awareness of what other influences might be at play here based on the past and what the family has gone through. I'm going to pass it to Stephanie since I know in case there's anything else you want to add.
Yeah, you're right. This is such a great question. And I know we can do further presentation on this too. One thing that I was thinking of is maybe even having a concrete skill or technique rather in the session. Could there be maybe like a structure to the session where you do perhaps some breathing exercises if it feels right for the family, or even having something tangible that like a fidget or something that they can work through and kind of manage those emotions if it's coming up in the session to help them bring their focus back to the present.
Thank you both so much. It was really Appreciate all of the wisdom that you shared today. It was a really great presentation, really engaging. It seems like people are also agreeing with me in the chat. Thank you all so much for attending. I also want to just give a quick plug for our upcoming CTAC events. We have a clinical intensive on trauma responsive telehealth for children, adolescents, and their families. It's a two-part training that's going to be on April 4th and April 25th. There'll be CEs available for that. And then also we're going to having an in-person uh, oh wait, maybe this is not sorry. We're going to having a fire setting and violent behavior risk assessment. I'm not sure if that's in person or not with youth and families on April 26th from 2 to 3:30. And again, CEs are also going to be available for that. Please, everyone, fill out those feedback surveys. And you can find registration links, by the way, for both of those on the CTAC website. All of our events are available on the CTAC website. Oh, sorry, it's going to be virtual via Zoom. Sorry about that. We are going to be doing more in-person events in the coming year. So if you're interested in in-person events, those are coming down the pipeline as well. So thank you all so much, and looking forward to seeing everyone at a future event. Thank you, Nicole and Stephanie, also.
Thanks, everyone.